and welcome to a special edition of The Big Story. I'm Salma Khalik, Senior Health Correspondent at the Straits Times. With me today is Minister Ong Ye Kung, who took on the health portfolio just 6 weeks ago and found himself immediately in the midst of the fight against COVID. Minister Ong, welcome. That must have been a very steep learning curve for you. Did you have any trouble coping with all that?
Well, thank you for having me. I didn't have a lot of time to think about a new job, new stresses. On the immediate term agenda is COVID. Yeah. I have been in the MTF for over a year now, first as Minister for Education and then Minister for Transport. So I'm quite familiar with the issues.
Right.
So just that transition didn't felt like a transition.
Well, previously you were just a member of MTF, now you're a co-chair. So, you know, your decisions matter a lot more today than it did, say, 2 months ago.
Well, although we had co-chairs and the structure for past 16, 18 months, we always have a small group of ministers who powwow over all the decisions before we go to the MTF and making them formal. So we've been working very closely with Min Wong and Kim Yong and Lawrence and Shun Sing and others. So that transition wasn't too drastic. We can talk about the big drastic transition, which is learning about the whole healthcare system. Wow, you are expert in this, but I think it's one of the most complex issues in any ministry.
I totally agree. I totally agree with you, and maybe we should have another session looking at the healthcare.
Yeah, that one I am transiting. I'm learning.
But today, let's stick to COVID. And since you've been on the MTF prior to becoming the health minister, could I ask you this? You know, at the end of May, Prime Minister Lee Hsien Loong spoke of the need to ramp up testing and contact tracing for COVID-19. Then barely a month later, MTF says that that will become less important and the focus will turn to the number of serious cases instead. So what prompted this shifting of gear? You know, was it political judgment, was it business driven, or was it science-based?
We're always science-based. Actually, the Prime Minister's broadcast, his key message wasn't testing. His key message during his broadcast was vaccination. That vaccination is the key to help us transit, to live normally with COVID. And so when we 2 weeks later talk about ramping up vaccinations, doubling it to 80,000 vaccination a day, those were in line with what the Prime Minister talked about. But of course, we are in this transition phase of vaccinating more of our population. And while we get there, and today we are 37% fully vaccinated, 58% partially vaccinated, it's an interim milestone. For us to arrive at a percentage that we are comfortable with, that transition process will take a month or two more. And during that phase, testing remains very important. Yeah. So I think it is in that context the Prime Minister talked about the importance of testing. So that has not changed. Today, we continue to need testing. Things like a Bukit Merah cluster, if not of testing, we wouldn't be able to suppress it. Yeah. As of now, I think we have pretty much suppressed that cluster.
Actually, could I refer to something that the MTF said just last week? You know, that by National Day, 2 in 3 people here would be fully vaccinated. Right, should be fully vaccinated. Yeah. But then the MTF then says that that number is not enough. So not enough for what? And realistically, what is enough?
I said that, yeah. Not enough for a few things. One is, I don't think it's enough for herd immunity. Yeah, herd immunity, especially with the Delta variant, which is more transmissible. We can talk more about that later. You probably need more than 2/3.
How much?
The scientists that did the simulation felt that you may need 80% or more. But that is for the Delta variant. You may have future variants as well. So I think herd immunity becomes a concept that is inversely proportionate to the transmissibility or the R0 of the variant. And that is something we have to continue to watch. Having said that, that doesn't mean the battle will be lost, because you can still have an endemic COVID. Just that you may not have herd immunity, people will still get infected, but they are fine. And so you you make COVID-19 more like influenza. You don't make COVID-19 like measles, for example, where you try to eradicate. And that is what you try to achieve through herd immunity. Not enough for what? The other aspect that is not enough, and I think this is the critical point, is that it's not enough to protect our seniors. While 2/3 full vaccination is important from the population point of view, for the seniors who are much more susceptible to a serious form of the disease, it needs to be much higher.
How much higher?
We wish we can reach the level of UK or some parts of UK, where over 90% are fully vaccinated. And if we can go to 90%, 100%, the more, the better. Yeah.
I noticed that several ministers are now trying to encourage seniors to go and get vaccinated.
In
so you have them
different
in dialects? Yes, exactly.
Yeah.
Right?
I was in charge of Hokkien and Mandarin.
And you did the Mandarin one too, right?
I did the Mandarin and the
Yes.
Hokkien. Josephine did the Cantonese, was very good.
What about Malay and Tamil? Anybody doing those?
Oh, yeah. Iswaran did Tamil,
Right.
and then we had Rahayu, who's our
Yes.
MOH as well, and she did Malay.
So, any effect from that? Do we see more seniors coming forward as a result of those?
As of yesterday, I noticed it went up by 1 percentage point.
Oh, that's very good. I mean, that's a lot when you
That's a
convert to
lot.
actual numbers.
Considering it's 500,000
Yes,
for those 70 and above. Yeah.
Right. So let's hope more seniors get vaccinated because that's extremely important.
Yes.
Could I turn to the opinion piece that the 3 co-chairs of MTF
Yes.
penned for the Straits Times? You know, in it you said that the population is battle weary. Was that a factor for the change in strategy? You know, you noted that COVID-19 is a shifting enemy, that we need to prepare for more changes as the situation evolved. Will this shifting in position, the opening up, closing, and then opening up again, induce more fatigue in the public?
It must be better awareness must be one of the considerations. You cannot expect people to live like that, restricting themselves, not meeting friends, not being able to travel, and some of them have families who are apart, unable to reunite, and cutting ourselves off, not allowing workers to come here, for example, to do the things that we need done. So we can't go on like that. So that must be one of the key considerations. Of course, there are other important considerations, such as the trajectory of the pandemic, the development of the vaccines and treatments that now we have at our disposal that make pandemic or make endemic COVID a possibility. So I think 2-3 major considerations has allowed us to reach this stage where we think it's possible for us to move to an endemic COVID stage.
When you talk about moving to an endemic COVID stage, what do you mean by that? In fact, I remember at the MTF, there was a talk about the new normal. What exactly is the new normal going to be?
Yeah. I don't think it will be totally like before, but it should approximate how life was like, so that we feel that life can go on and my life is not on a standstill. There are a few psychological milestones. We sort of alluded to them in our op-ed piece, but we just imagine today, if you are sick with COVID, you are isolated. Yeah? Doctors will assess those who they think is a bit more risky by age, by comorbidities. You may be admitted to hospital, even though you may be fine.
Right.
Or we may think that you are high risk, hospital and CID. Those who are less risky go to community care facilities where there are doctors and nurses as well. Can we imagine a time where the default is to say, here's an MC, go home, isolate yourself, rest, and here's a bunch of test kits. You test yourself every X days until you are fine, then you can come out. Let your employer know, and your employer should allow you to just stay at home and don't demand your MC. That's a big change from now. That is part of endemic COVID. Can we imagine that? It's a big psychological shift, right? That's just one. 2 is today you get an SMS, you're quarantined. Can we imagine a day where your SMS doesn't say you're quarantined, just say you are exposed, go home, get a bunch of test kits, test yourself, isolate yourself, don't move around too much, just go out for essentials, So quite a different concept, right?
Actually,
Third shift, whether we can imagine, you can start to travel. Yeah? No SHN, at least to selected countries that has also brought down the infection rates. You see many parts of Europe already like that. You see the US cases crashing down. You see Japan, Korea. Japan stable, Korea also quite stable. And then there are also the Asian countries that, like China, that has more or less keep it to a very low level. Can we imagine just taking a test, going there, taking a test, coming back, no SHN? Right now, all these are not quite imaginable, but these are the key milestones transiting to endemic COVID. You're bursting to ask me a question.
Yes,
yeah,
Mr. Ong, I think I must have a very vivid imagination, because not only can I imagine those scenarios, I'm actually thinking that when we accept COVID-19 as endemic, why are we still talking about testing? We don't test for the flu, we don't test for dengue. Well, we do test when they have symptoms, when they turn up at the polyclinic or at a doctor's place. But we don't go around testing people because it's no longer necessary. I mean, it is endemic.
I think it is. We test to protect those who are not vaccinated. Yeah, it can be because we live with an old folk who is not vaccinated. So to protect them, we have to test ourselves so that we don't pass to them. Young children, I hope at some point the clinical trial results will come out and young children can get vaccinated, but in the coming months, I don't think they will be. And so we should also avoid passing the virus to them. I think
No,
that's why.
I agree, not right now. I mean, testing and all still needs to go until a certain number of people have been vaccinated, or at least everybody who wants the vaccine has had a chance to be vaccinated. So can I just do a quick back of the envelope calculation, right? So by National Day, everyone who wants to would have at least had their first jab. They would have at least had the chance to have one jab, right?
In the next few days, everyone who wants a jab would have been offered a booking slot.
A booking slot, but they may not have had the jab.
They may not
so,
have,
So by, say, end of this month, end of July, everybody who wants to probably would have had the chance to get the first jab.
First jab, yes.
Moderna needs 4 weeks for the second jab.
Yeah.
So by end of August or early September at the latest, the entire population that wants to and is eligible for the vaccine would have been vaccinated, right?
If
so
you want to, yes.
Would that be a good time to open up and relax a lot of our measures now and return to our new normal?
I agree with the concept you just painted,
Right.
but I don't think you want a button you push and suddenly all open. So you have given a time frame that I think is quite realistic based on the supplies and delivery capacity that we have. The key thing is supplies is no longer a constraint, but you don't want a sudden open up. You want a gradual step-by-step open up. So I think what you will see is not a big bang opening end of August or September, but a progressive one. Yeah, I know many Singaporeans.
Why is there a need for a step-by-step opening up?
Kim Yong used the analogy before. He's an electrical engineer. He said when your house trips, you don't just turn on the whole thing because that short circuit may still be there. So you switch on one by one until you feel everything is safe.
Oh God, he's an engineer, isn't he?
You do need some engineering
yes.
thinking. But you do need a step-by-step opening. I think there are a few advantages. First, you manage the risk in case some settings open up a lot of risk. Yeah, and they do happen. Second is that you give people a sense of progression.
Right.
Rather than waiting for that big day when everything
Everything
opens.
goes, yes.
Yeah, and then you go crazy.
So in other words, we can expect some relaxation this month in July, and then I believe the original plan was sometime middle of this month.
Well, we said 12th of July.
Yes.
That's our next milestone.
Right.
Including for dining. Now it's for two. So I hope more young people go out and have dates during this period. But come 12th of July, of course, we are looking at opening up to more people to dine together. Yeah, and whether there are other opening that we can consider, all those we'll think about 12th July. Beyond that, at MTF, we also mentioned two other milestones, right? One is 50% fully vaccinated. That probably will happen second half of July.
Second half of July, 50% fully vaccinated.
50% fully vaccinated. That is another milestone where we can think about another step of opening. And then National Day, where hopefully we mark with a National Day parade as another step of opening before we reach the endemic COVID stage. You want the transition to be a transition, step by step, where you slowly move towards it, as opposed to a sudden transition. Yeah.
Right. So now it's July, August, by September. What happens if everybody who is eligible to be vaccinated, the numbers do not reach your 90% that you think is necessary for herd immunity?
90%
what if it's 80,
will be
85%?
90% will be very hard to reach, but I'm really hoping that for the most vulnerable groups, namely the seniors, that we can approach a figure somewhere near there. Yeah. But 2/3 fully vaccinated by National Day, I deem it an interim milestone. We got to go further than that.
We can go further.
Yeah.
And then by September, when they have all who want to would already be fully vaccinated, we will be at the end of this step by step. We will be more open, no mask, no more contact tracing, no more testing.
You said many questions in one. I will put it like that. I know you're going for news, but I think we have milestones. Yeah, one milestone is 12 July. That really less dependent on vaccination, but just the fact that we got the clusters under control. Some opening, I think, is something we are seriously considering and monitoring the situation. Cases have been low last 2 days, and I believe today as well. And then 50% fully vaccinated, sometime second half of July. Then another milestone, 2/3 fully vaccinated, sometime around, plus minus, sometime around National Day. And beyond that, maybe we can reach 70%, 75%, hopefully 80%, I don't know. And especially if young kids start to be able to get vaccinated, that will allow us to go even further. So these are the milestones. What are the steps to open? I mentioned them just now. Some are big psychological steps. Just yesterday when we changed the format of reporting, I already got questioned, why you change? I want to know the details of the cases. So I think the constraint too is how much actually our people can accept the changes. It is one thing for all of us to cheer that we want to move towards endemic COVID, but when the changes actually happen, some can accept, some can't accept. So I think what we are doing now is marrying those steps with the milestones. Yeah. So I can't tell you too far ahead, but I think we can do something within the month of July. At least there'll be 2 steps that we're looking at.
Right. So
And
2
then-
steps in July.
And then one more step, National Day.
August, yes.
August, sorry, yeah.
You know, what you said about some people not able to accept, you're very right, because, you know, countries around us, the region as well as in the world, are bracing for more COVID cases, surges, etc. And then people remember that in March, a lot of people said we should have closed our borders early, and because we didn't do it as early as they would like us to have done it, they say the current clusters is because of that. So is Singapore now moving on too fast to open? Australia and New Zealand, the moment they see a couple of cases, they lock down again. Is that something Singapore is planning to do as well?
You mentioned earlier a question too, that this opening and closing is most unsettling. It is, no? And I think in Australia there is quite a strong blowback about the constant opening and closing. And Australians, I think, frustrated too with this. It's something we want to avoid. At the beginning of the pandemic, when our tools are limited, lockdowns, closures is one of the few things you can do. Yeah, but vaccination has changed that. So I think what we want to do now is with better testing capability, and then in time vaccination of great majority of our population, you reduce this sort of uncertainty. So we have already come a long way if you think about it. This heightened alert didn't involve the closure of the entire economy. It was very much an F&B lockdown and a gym lockdown. Yeah. So the great part of our economy, from services, manufacturing, construction, they all could carry on, right? It was quite unlike last year's circuit breaker lockdown, where everyone just stayed at home, nothing. You know, manufacturing workers don't go to work as well, unless you're in very essential services. So I feel we have put that behind us. So that uncertainty for all these sectors are behind us. Right now with vaccination, what we are trying to do is whatever we did for the other sectors, let's try to do it now for the gyms and for the F&B and entertainment outlets. Can we also reach a stage where we say that even we have some clusters, there's no need to lock down because we are sufficiently, there's no need to close these businesses because we are sufficiently vaccinated. The third stage, and I think that's the hardest, is can we reach a stage where we can do the same for tourism and aviation? And that is the final recovery step. And that is
that's
the
something
hardest.
a lot of people are looking forward to. Singapore is such a small country. Everybody travels
Yes.
every year, and not traveling since last year for holiday,
Yeah.
just for,
Yeah.
you know.
That is also where is the highest risk, as you mentioned.
No, but
Right.
you see, if somebody is vaccinated, right, they're less likely to catch the
Less likely,
virus.
but they can
They
still
can,
have it.
and they
still
can
have-
spread it
yeah.
to others. But it's a lot safer, isn't it? Because what's the point of all of us going for our vaccines if we do not get that freedom to live life as normal?
Exactly. So I think this is really the central dilemma as we get closer and closer to the harder sectors, which is aviation. That will be the hardest. And in a way, the outbreaks that happened everywhere in Guangdong, it came in, Delta variant came in by air. Australia, same thing, a mix of different variants went in mostly by air, by travel. So every country had to grapple with this dilemma. You want to have normalcy, which means aviation routes must open, but you open yourself to risk. There are ways to manage this.
Like, for example?
You must know very well the pandemic trajectory and the risk of every region. And right now is no travel anywhere, so it's not as if we have a very difficult choice to make. Just we can identify where are the safe regions, open up to them first, like what we do with Hong Kong.
We are still struggling with Hong Kong, aren't we?
Yeah, we're going to call it air travel corridor from now. Yeah, the word bubble is a bit of a jinx, I think. So we
You think that's going to make it faster, calling it an air corridor?
we try whatever works now. I think fundamentally is both of us are more or less in a good place now. And both of us are vaccinating. And I think this put us in a good position to relook at some of what we had looked at before.
What about Thailand? You know, they're having the sandbox in Phuket. They say 170% of the population there is vaccinated. They're opening up for tourists. Incidence of COVID is still there, but very low. The numbers are very low in Phuket itself, although not for the rest of the country. So if Singaporeans want to go to Phuket and they come back, would they still need to SHN?
I'm afraid you have to. In the end, when we differentiate between countries that are safer and countries that are risky, it is less to do with their own rules on SHN and their sandboxes, but to do with their general infection rates. And that is the first level. And that infection rate has a lot to do with their vaccination rates as well.
Right.
And their control and their testing and all their pharmaceutical interventions. So today, I monitor every day and go to the websites. You can see where are the places in the world where cases are crashing, infection rates coming down, and those must be the places that we look at first, purely from scientific public health point of view.
So how low an infection rate would you say makes that country a good place for Singaporeans to travel to?
I think once a place trajectory is downwards, vaccination going up, and you go below, say, 3 per 100,000, we should start looking at those countries seriously.
So could you name me a few of those countries so we
You
can
can
start
search
looking?
most of EU, the US, Korea. These are places where it's trending down. Korea not so much, but the other places, these are places that are trending down.
So we
although
can
the
go to
UK, due to Delta variants, it is also spiking up. But we are watching it closely, the situation closely. But it would appear that while cases are spiking up, you're not seeing a lot more ICU and deaths compared to before. Part of the reason is their elderly and their seniors are well vaccinated. And the spike is mostly caused by young people falling sick, and they don't fall sick as seriously as the older people.
Now, before we leave the subject of travel, just one last question. So do you see Singaporeans being able to travel for holiday and leisure before the end of this year?
I certainly hope so, and I share that aspiration.
And the possible countries, as you say, are places like Hong Kong, Europe, and the US.
As of now, but one thing I learned is that the situation changes every month. Whichever country or region is doing well this month, next month you are down at the bottom.
No, but then that also depends on the vaccination rate. So if the vaccination rate is high, that's not likely to fluctuate much,
I
right?
hope you are right. I really hope you are right. But you know, the virus sometimes have other ideas.
Talking about the virus having other ideas, so people who are not vaccinated in Singapore, whether for medical reasons or because they're too young to get a vaccine, or just because they don't want to, what's going to happen to them when Singapore opens up more, when we start treating this as an endemic disease?
Yeah, I think for those who are not vaccinated, they will pretty much depend on the rest who are vaccinated to retard the transmission of virus and prevent themselves from getting it. Yeah, so therefore, what we always say, when you get a vaccination, you're just not protecting yourself, you're protecting your family and also protecting the whole of society.
Mm-hmm. Yeah. But will there be some form of vaccine discrimination, for example? Like somebody who has been vaccinated and travels and somebody who has not been vaccinated and travels, or attending concerts, or things like that. Will there be some form of vaccine discrimination?
Yeah, I wouldn't use emotive terms like that. I think two levels. One is just think about it from a public health point of view. Who is higher risk, who is lower risk? I think if there is a basis, namely vaccination, to differentiate who is of higher risk and lower risk, those of lower risk, and by the time everyone should be offered, can get if they want to, and majority have gotten it, I think that there is good justification to say that since you're of lower risk, maybe there are some privileges, things that you can do in bigger groups, in closer setting. I think to approach normalcy for these sort of events, I think from a public health risk management point of view, it is something reasonable to do. Then there is the other social aspects that if you do that, would people start to feel I'm excluded, I go out with a family and I'm a kid below 12 years old, I can't go out with my parents and have a meal with a bigger group of family and friends. And so I think we will also need to think through these issues to see whether some dispensation is appropriate.
Right.
Yeah, so these are all work in progress.
Right. Some infectious diseases experts I've spoken to are saying that there are certain vaccines in Singapore that are mandatory. For example, the measles vaccine. It's legally obligatory. Why don't you make COVID-19 the same?
It is an important consideration. As of now, it's not appropriate because the vaccines are approved under our PSAR scheme,
Right.
which is in fact under emergency
Use, yes.
use, you see. So under emergency use, you can't really make it mandatory. In time to come, perhaps.
Right. So when it becomes a standard vaccine,
Yeah.
Approved the normal way, then it may become
Something to think about. Yeah. As of now, it's not appropriate.
And people are also asking, if booster shots are necessary, will the government continue paying for it, or will it be like some of the other vaccines where we can draw on our MediSave, or is it going to be out of pocket expenses?
We'll think about all these questions. Right now, let's get to 2/3 fully vaccinated first.
I think everybody is anticipating that and anticipating.
So are we.
the
So
opening
are
up.
we. We got to
Yes.
think through it. Yeah.
Right. So, thank you very much. I mean, that's been a really interesting session. It shows us a bit of the exit plan that Singapore is going to have. But before I end this session, could I ask, on a personal basis, has taking on the COVID fight affected you personally or your family life in any way?
What family life?
Well, all your daughters are vaccinated, aren't they?
The whole family
Yes.
are vaccinated. There's no more weekend, there's no more rest day. Yeah. Meetings are just piled up. Emails come in from public and from colleagues, come in fast and furious. So it's been like that for over a year. Yeah.
So what did you do before COVID? I mean, did you have family time with them? What would you do?
There used to be some.
Like, what would you do? I mean, is it just eating breakfast together, or do you go out together? Do you have any regular
You
activities?
order in usually, and there was a period where you allow 5 people, 8 people to go out.
No,
and-
pre-COVID.
Oh,
What was
pre-COVID.
your life like pre-COVID?
Oh, that's so long ago, I can't remember.
Did you have a life
okay,
pre-COVID? Yes.
I think that's post-politics, but before COVID.
Right.
I think over the weekend, there will usually be one evening, whether Friday night or Saturday night, that we can go out as a family.
Right.
Yeah, I think that we try to do. Yeah. Right now the good thing is many events are cancelled. So I am at home, but just very busy with work. But we can order in and we can still spend some time together.
So the family still spends time together?
Actually, more so than before, because events are cancelled, gatherings are cancelled.
And everybody's working from home?
Yeah. Except that's a good thing. The bad thing is everyone is on their computer in their own room watching their own Netflix. We got to spend a bit more time coming out and talking to each other.
So can I ask you, the moment things are really normal, back to normal, what is the first thing you plan to do as a family?
Travel, probably. Travel.
This year, hopefully?
Certainly hope so. As I say, I share your hope. And
Well, thank you very much,
Thank
Mr.
you.
Ong. That's been extremely interesting session. To all our viewers out there, do keep abreast with the latest in the coronavirus in Singapore and around the world at straitstimes.com. And be sure to tune in to The Big Story at 5:30 every weekday. I'm Salma Khalid, Senior Health Correspondent at the Straits Times. Goodbye and stay safe.